Our hearts, the tireless engines of our bodies, deserve all the care we can give them. Just like a well-maintained car needs regular checkups, our hearts benefit from assessments that ensure they're functioning optimally. This is where stress tests come in, a valuable tool used by doctors to evaluate heart health under pressure. These tests provide crucial insights into how well our hearts handle exertion, revealing potential issues that might not be apparent during rest. Imagine your heart as an athlete preparing for a big race. A stress test is like a controlled training session for your heart, allowing doctors to monitor its performance under increased workload. During the test, you'll be asked to exercise, typically on a treadmill or stationary bike, while your heart rate, blood pressure, and EKG readings are closely monitored. The test gradually increases in intensity, simulating the effects of physical activity on your heart. This helps doctors identify any abnormalities in heart rhythm, blood flow, or oxygen supply that might signal underlying heart conditions. Just as our physical abilities change with age, so too does the performance of our hearts. As we grow older, our bodies undergo a myriad of transformations, and our cardiovascular system is no exception. The heart, a vital organ, experiences changes that can impact its efficiency and overall function. As we get older, our hearts naturally undergo changes that affect their efficiency. The heart muscle, for instance, may become slightly stiffer, making it less able to pump blood effectively. The heart muscle may become slightly stiffer, which can lead to a decrease in the heart's pumping ability. This stiffness can also make it harder for the heart to fill with blood between beats. Blood vessels may lose some elasticity, which can contribute to higher blood pressure and reduced blood flow to various parts of the body. This loss of elasticity can make it more challenging for the heart to circulate blood efficiently. Additionally, our maximum heart rate tends to decrease with age. This means that during physical activity, an older person's heart may not be able to beat as fast as it once could, limiting their exercise capacity. These age-related changes are a normal part of aging, and while they can affect physical performance, they don't necessarily indicate a health problem. However, they do mean that older adults may need to adjust their activity levels and be mindful of their heart health. These changes can influence how doctors interpret stress test results. Stress tests are used to assess how well the heart functions under physical exertion, and age-related changes must be taken into account to accurately evaluate heart health. What's considered a healthy response in a 20-year-old might raise concerns in someone twice their age. For example, a heart rate that is normal for a younger person might be too high for an older adult, indicating potential issues. That's why doctors use age-adjusted benchmarks to evaluate stress test findings. These benchmarks help ensure that the results are interpreted correctly, taking into consideration the natural changes that occur with aging. By using these age-adjusted standards, healthcare providers can better assess heart health and recommend appropriate interventions or lifestyle adjustments. One of the key metrics assessed during a stress test is your heart rate. As you exert yourself, your heart rate should increase to meet the body's demand for oxygen. However, the expected increase varies depending on your age. It's important to note that these are just general guidelines. Your doctor will consider various factors, including your overall health and fitness level, to determine your target heart rate zone. Section 5. Deciphering the results, what your stress test means. Once your stress test is complete, your doctor will analyze the data collected to assess your heart's performance. This involves a detailed examination of various parameters such as your heart rate, blood pressure, and electrocardiogram (EKG) readings during the test. The results can provide valuable insights into your cardiovascular health, revealing potential issues or offering reassurance. Your doctor will look for any signs of stress on your heart, which could indicate underlying health problems. Normal results: if your heart rate, blood pressure, and EKG readings remain within the expected range throughout the test, it generally indicates that your heart is functioning well under stress. This means that your heart is able to handle physical activity without any significant issues. Abnormal results. Abnormal findings during a stress test might include irregular heart rhythms, inadequate blood pressure response, or changes in your EKG pattern. These irregularities can be a cause for concern and may require further investigation. These abnormalities could signal a range of cardiovascular problems, such as coronary artery disease, heart valve issues, or problems with the heart's electrical system. Coronary artery disease, for example, occurs when the arteries that supply blood to the heart muscle become narrowed or blocked, leading to chest pain or even a heart attack. Heart valve issues, on the other hand, involve problems with the valves that control blood flow within the heart. These issues can lead to symptoms such as shortness of breath, fatigue, and swelling in the legs or ankles. Problems with the heart's electrical system, known as arrhythmias, can cause the heart to beat too fast, too slow, or irregularly. Arrhythmias can lead to symptoms like palpitations, dizziness, or fainting. If your stress test results are abnormal, your doctor may recommend additional tests to further investigate the cause of the abnormalities. These tests could include imaging studies, such as an echocardiogram or a cardiac MRI, to get a more detailed look at your heart's structure and function. Based on the findings, your doctor will discuss potential treatment options with you. This could range from lifestyle changes such as diet and exercise modifications to medications or even surgical interventions, depending on the severity of the condition. Remember, the goal of a stress test is to provide a comprehensive assessment of your heart health. By understanding what your stress test results mean, you can take proactive steps to maintain or improve your cardiovascular health and overall well-being. Always consult with your healthcare provider to interpret your specific results and to develop a personalized plan that best suits your health needs. Section 6. Abnormal results, causes and concerns. Understanding the implications of abnormal stress test results is essential for your health and peace of mind. Abnormal stress test results don't always mean you have a serious heart condition. Sometimes factors like dehydration, medication, side effects, or even recent physical activity can influence the results. It's important to consider these variables before jumping to conclusions. Anxiety is another common factor that can skew test results. The stress of undergoing the test itself can sometimes cause abnormal readings. It's crucial to remain calm and follow your doctor's instructions closely. However, it's crucial to take any abnormal findings seriously and discuss them with your doctor. Ignoring these results can lead to misdiagnoses of potentially serious conditions. Your doctor will help you understand the significance of the results and the next steps. If your doctor suspects an underlying heart problem, they may recommend further investigations, such as coronary angiography. This is a more detailed test that can provide a clearer picture of your heart's health. This procedure uses X-ray imaging and a special dye to visualize the coronary arteries, checking for blockages. The dye makes the arteries visible on the X-ray, allowing doctors to see if there are any areas of concern. Another option is an echocardiogram. This test uses sound waves to create images of your heart, providing valuable information about its structure and function. This ultrasound test creates images of your heart, allowing doctors to assess its structure and function. They can see how well your heart is pumping and if there are any abnormalities in the heart's chambers or valves. The detailed images from an echocardiogram can help doctors diagnose a variety of heart conditions, from valve problems to heart muscle issues. It's a non-invasive and informative test. Lastly, they might suggest a Holter monitor. This device is worn continuously for a period, usually 24 hours or longer, to record your heart's activity. This portable device records your heart rhythm over 24 hours or longer, detecting any intermittent irregularities. It's particularly useful for identifying issues that may not show up during a standard stress test or in a short-term monitoring session. By wearing the Holter monitor, you can go about your daily activities while it collects data, providing a comprehensive picture of your heart's rhythm over an extended period. This can be crucial for diagnosing conditions like arrhythmias that might not be evident during a brief examination. Always follow your doctor's advice and ask questions if you're unsure about any part of the process. Your health is a collaborative effort between you and your healthcare team. Section 7. Beyond the numbers, lifestyle factors and heart health. While stress tests provide valuable information about your heart's health, it's essential to remember that they're just one piece of the puzzle. Your lifestyle choices play a significant role in your cardiovascular well-being. Factors like diet, exercise, stress levels, and smoking habits can all impact your heart health. Adopting a heart-healthy lifestyle can help reduce your risk of developing cardiovascular problems and improve your overall well-being. Section 8. The importance of personalized advice, consulting your doctor. Understanding your stress test results can be empowering, but it's crucial to remember that this information is most meaningful when interpreted within the context of your overall health. Your doctor is your best resource for understanding what your results mean for you. They can consider your medical history, family history, lifestyle factors, and other relevant information to provide personalized advice. If your results indicate any potential issues, your doctor can recommend the most appropriate steps to address them and keep your heart healthy. Section 9. Prioritizing heart health at every age. Stress tests serve as a valuable reminder of the importance of heart health. No matter your age, taking proactive steps to care for your heart is always a wise investment. By understanding the role of stress tests, the impact of age on heart performance, and the significance of lifestyle choices, you can make informed decisions to support your cardiovascular well-being for years to come.